Many spinal injuries occur from dives into shallow water. It is very important to recognize a possible spinal injury and to use the proper techniques to promptly rescue and care for the victim.
A person with a spinal injury will often be face down in shallow water. It's important to quickly move them face up while stabilizing the head and spine. The best way to do this is by using the head splint maneuver. This maneuver has been proven to be the most effective method. Carefully approach the victim and grab her upper arms near the elbows, trapping the head between the arms. Maintain pressure as you move the victim forward and roll her over. As she's rolling, lower yourself to neck depth, placing your forearm under the victim's shoulder for support. Check that the victim's arms are over your shoulder, next to your ear. If the victim is on the bottom in a face-down position, approach the victim from above or behind, depending on the victim's position on the bottom. Trap the victim's head using the head splint rescue and transport him to the surface with the face angled toward the bottom to avoid getting water in the victim's nose and possibly into the stomach and lungs. Once you reach the surface, turn the victim to a face-up position. Transport him to the nearest side of the pool. Backboarding requires 2 rescuers. Rescuer 1 brings the victim to the side of the pool and checks for breathing. Rescuer 2 grasps the victim's arms and applies pressure to trap the head, maintaining the victim in a horizontal position. Rescuer 1 places a rescue tube under the victim's knees, then checks for breathing again before retrieving the backboard, removing the straps and submerging it under the victim.
He's breathing.
With the backboard in place, Rescuer 1 attaches the chest strap, making certain that the strap is snug and not under the board. He then traps the victim's head to the board by placing one arm on the victim's sternum and cupping the victim's chin with fingers on one side and thumb on the other. He then places the other arm beneath the backboard. After lowering the victim's arms to his side, Rescuer 2 takes a head immobilizer pad and positions it next to the victim's head, then places the second pad in the same manner. The head strap is now applied. Meanwhile, Rescuer 1 continues securing the victim to the backboard. He attaches the waist strap with the arms secure. Then moves the rescue tube from under the victim's knees to a position under the foot end of the backboard. The leg strap is then attached. All straps should be snug and clear of the underside of the board. A second rescue tube is placed under the foot end of the backboard if needed. The victim is now ready to be lifted out of the water. On the agreed-upon count, both rescuers lift and slide the backboard onto the deck. The victim is checked for signs of life, and other rescuers arrive to assist with care for the conditions they find. This may include rescue breathing, CPR, and the use of an AED. a spinal injury victim in water less than 2 feet deep, the head splint is first applied, trapping the victim's head between his arms. As the victim is being rolled over, Rescuer 2 places the backboard under him so that he rolls onto it in a face-up position. While maintaining the head splint, Rescuer 1 moves slightly to one side of the backboard as Rescuer 2 moves next to him at the head end. Grasping the backboard, Rescuer 2 drags the board and victim out of the water and onto the shore, as Rescuer 1 continues to apply the head splint. A third rescuer arrives to assist with care. The victim is covered with a thermal blanket to help keep him warm. Someone who has a spinal injury will not necessarily be paralyzed and may even approach the lifeguard on deck. Stabilize the victim's head and neck by grasping his head with hands on each side of his face near or over the ears. Tell the victim not to move until directed to do so. Ask him, "Are you okay? What happened? Do you feel pain anywhere? Can you move your fingers? Can you move your toes? Do you have any pain in the neck?" A second lifeguard should gently touch the back of the neck slightly to the right and left of the spine to help identify if there's pain in the area. It should not be unbearable pain. If the victim will be more comfortable, move him to a sitting position while supporting the neck and head. Call EMS and continue to support the head and neck until EMS arrives and assumes control.
Lifeguards should know the basics of how to use mask, fins, and snorkel.
Even the best-fitting mask will sometimes become filled with water. You can clear the mask without surfacing by pressing the mask toward your forehead with your head tilted back and blowing out your nose. Air pressure causes water to exit the bottom of the mask. You can clear a snorkel by blowing the water out as soon as you surface. You can then take a breath. You can also use the displacement method. Surface with your hand up and your head up. Just before reaching the surface, gently exhale into the snorkel, making sure the top of the snorkel is positioned down. When your hand breaks the surface, tilt your head forward and breathe easily using the snorkel.
Scuba diving is a popular sport, and it's possible that you could be called upon to rescue a scuba diver, particularly since you may be on duty during a class.
Approach the distressed diver and encourage her to inflate the BC and drop the weight belt if she has one. If the diver doesn't respond to your instructions, perform a front active victim rescue and tow her to safety. If you are rescuing a submerged diver, perform a surface dive, clearing your ears as you descend. Approach the diver from behind, reach around her, and inflate the diver's BC. Drop her weight belt if she has one. Make a controlled, slow ascent to the surface. Stabilize the diver by placing one hand over her arm and under her back. If necessary, remove her mask and regulator. Check the diver's breathing and tow her to safety.